I am Professor Jean-Pierre Becquemin. I am a French vascular surgeon. I used to work in a big university hospital close to Paris, which is in Créteil. And I was a director of the vascular and cardiovascular department for many years. And then 4 or 5 years ago, I left the institution to practice in a private hospital. So I am very well involved in all the vascular stuff, and also I did a lot of publications, and the latest one is the one we will discuss now. The study was organized because in France, to get the approval for reimbursement, we need to provide, and at least companies need to provide the data, 5 years data on multicenter levels, just to make sure that there is no problem with the graft and with clinical results. So this study started 5 or 6 years ago, and with a former graft, which is a Captivia graft. And then we have the results now, and I will present you the results and all the stuff about this graft. The study population was patients with thoracic aortic pathology, which include aneurysm, dissections, transection of the aorta after blunt injuries, and then ulcer of the descending aorta. It did not involve the aortic arch, but all the pathology close to or below the subclavian artery. The key findings was that the results, the 5-year results, were quite good. There were very few failures. There were, on the population of 180 patients, 30% of them having been treated in urgent setting. And despite this very challenging population, the results at 5 years ago, 5 years were very good, with good clinical results, good survival, whatever the pathology, and which make us very confident in the quality of this graft. The clinician, well, first they have to know how the graft works. Second, they have to have a good equipment with a hybrid room. What would be the best to make sure that the graft is placed in the right positions, and then also be trained to do this type of procedures. You know, it's frequently very urgent at night, or and so they are to be very trained to have these very good results we are presenting today. Well, the TEVAR, you know, the evolution of the TEVAR in the aortic thoracic disease is about the arch, and where we need a different type of graft, with branch graft or fenestrated graft. There are different coming on the market. It's not very frequent pathology. The descending aorta is much more frequently had this type of pathology. But anyway, it's a work in progress. And we are very optimistic that in some very soon open surgery will be only something which in the medical book, history of medical book.